Assalamu alaikum doctors, welcome to my YouTube channel MBBS and BDS lectures. Today is the 17th video of rapid revision course of operative dentistry, which is very important for NLE exam, MDS as well as for BDS final year students. In this video we will cover the whole non-carious lesion chapter. Now start from the non-carious lesions. Mostly in our teeth, the lesion developed due to caries. If lesion is other than caries, this is known as non-carious lesion. But look at here, there is a non-carious cervical lesion. Why it is called cervical lesion? Because mostly it occur on the cervical area of the teeth. Therefore, non-carious lesion is also known as non-carious cervical lesions. How we define? A class 5 lesion resulting from factor other than dental caries is known as non-carious cervical lesions. Mean resulting from factors other than dental caries is known as non-carious cervical lesions. Now come to the types. There are 4 types of non-carious cervical lesion. Number 1 is erosion, second is abrasion, third is attrition, fourth is abrasion. Now, first, what is erosion? Like we already studied, erosion is the loss of structure, eroded area, but due to from chemical dissolution. Loss of structure from chemical dissolution. If two structure are lost because it dissolve in the chemical, this is known as erosion. Second is the abrasion. Again in abrasion there is a loss of the structure, but by mechanical or frictional forces. This is known as abrasion. Like in improper brushing, there is a frictional forces which acting on the teeth. In the result, there will be loss of the structure. In erosion, like in chemical dissolution, like we take acidic drink, like in gastroesophageal reflux disease, the stomach acid come in oral cavity and they dissolve the teeth. Third is the attrition. Attrition is a loss of tooth structure due to opposing teeth. This is known as attrition. Then we will study further. In attrition, there is a 2 types of attrition. One is physiologic and other is the pathologic. Pathologic attrition occur due to bruxism. In night, the stress, tension, patient occlude their teeth. In the result, due to opposing teeth, the loss of tooth structure, this is the attrition, which occur in the young age. This is pathologic due to bruxism. But if occur in the old age, this is physiologic attrition. Fourth is the abrasion. What is abrasion? Loss of cervical tooth structure. Here the cervical tooth structure loss due to occlusal forces. If patient have high occlusal forces, mean patient occlusion is disturbed. Mainly our occlusion is in the centric relation. If patient occlusion is in incentric relation, mean eccentric relation other than centric relation, in the result there will be abrasion. Now come to the detail of each types. Here in this chart, there is a each type, non-carious lesion type, its definition, its appearance, and its management. First type is the attrition. Look at below in diagram. In attrition, the enamel and dentine wear occur in same rate, and it occurs due to opposing teeth. And how clinically we identify this is attrition? Because attrition occur on the incisal surfaces of anterior teeth and occlusal surfaces of posterior teeth, and there is a yellow dentine visible on the incisal or occlusal surfaces of the teeth because the enamel is lost, dentine is also lost, and the yellow dentine is visible, and there will be sensitivity per patient. This is the attrition. Now, what is the definition of attrition? Loss of tooth structure caused by tooth to tooth contact by mastication or parafunctional habits like bruxism. If due to mastication, it is a physiologic attrition because there are two types of attrition. Physiologic occurs due to mastication in old age, but pathologic occurs due to parafunctional habits in young age like bruxism. This is the definition of attrition. Second, appearance. Appearance, flat surfaces and wear facet and incisal and occlusal surfaces. Look at below diagram attrition. Flat surfaces, the loss surface will be flat, and wear, the loss of tooth structure, wear facet on incisal and occlusal surfaces, enamel and dentine wear at the same rate. This is the appearance. Now come to the management. The management is patient education regarding parafunctional habits like bruxism. We should educate the patient if it come in young age for parafunctional habit like bruxism, and we should give night guard to the patient. If it is physiologic, then there is no problem. And if patient feel sensitivity, then we go for composite filling. If its pulp is not exposed. If its pulp is exposed, then we should go for root canal treatment. Now come to the second type is the erosion. Loss of tooth structure due to chemical process. Like in anorexia, bulimia, frequent soda intake, frequent vomiting, and gastroesophageal reflux disease, and exposure to chlorine in swimming pool. In all these conditions, there is a chemical, and in this condition, there is a chemical dissolution of the tooth structure. In the result, there will be loss of tooth structure. This is known as erosion. Appearance. How clinically in clinic or in hospital ward, how we diagnose this patient or tooth structure, loss of tooth structure is due to erosion. There will be ill-defined saucer-shaped lesion. There will be saucer-shaped lesion. Look at erosion. There is a saucer shape, depression area. On the buccal or palatal surface of teeth and occlusal surface of posterior teeth in case of GERD, gastroesophageal reflux disease. In GERD, there will be an occlusal surface, but other than GERD, there will be an buccal or palatal surface of teeth. There is a ill-defined saucer-shaped lesion. If amalgam restoration, there will be rise amalgam restoration, increase incisal translucency, and loss of surface characteristics of enamel. The surface shyness of enamel, surface characteristics will be lost. Now come to the management. The management of erosion is diet advised to reduce consumption of acidic drink. Do not brush directly after drinking acidic drink. Chew sugar-free gum to stimulate salivary flow or rinse with water. If cause is medical like GERD, bulimia, anorexia nervosa, then refer the patient to physician. Now come to the abrasion. The third type is the abrasion. In abrasion, there is a loss of tooth structure due to mechanical friction with a foreign object like improper toothbrushing, and patient bite on fins, toothpicks. In the result, there will be abrasion. The appearance will be V-shaped notch with smooth polished internal angle on the buccal cervical area of teeth. Remember, abrasion occur mostly on canine and premolar. This is the MCQ's point. and there will be V-shaped notch with smooth polished internal angle. Now come to the management. The management is, look at the below diagram, there is the abrasion. Abrasion. In the last diagram, there is a abrasion. Now, the management is advise patient to switch to soft toothbrush if patient use hard toothbrush because it causes mechanical friction. Advise patient to switch to soft toothbrush plus educate on proper brushing techniques. Fourth is the abrasion. In abrasion, how we define abrasion? Loss of tooth structure at cervical areas due to abnormal occlusal load causing flexure of the tooth and micro cracks on cervical area of the teeth. This is abrasion. Now come to the appearance. There is a V-shaped notch with sharp dull internal angle. If V-shaped notch with smooth polished internal angle, it is abrasion. If V-shaped notch with sharp dull internal angle on buccal or labial surfaces of teeth, especially teeth that have excursive interferences or eccentric occlusal load, mean other than centric relation. This is the appearance of abrasion. Look at the diagram. Abrasion is the more severe. Now come to the management of abrasion. In abrasion, if patient have sensitivity, we go for composite filling. If pulp is not exposed, if pulp is exposed, then we go for root canal treatment. After that, we will give composite filling in cervical areas. This is all about non-carious lesion. Now for MCQ's point, which point are important? First, if there is the loss of tooth structure due to mastication or parafunctional habit, if loss of tooth structure due to tooth-to-tooth contact, this is attrition. If it occur in young age due to bruxism, parafunctional habit, this is pathologic. If it occur in old age, this is physiologic. It occur due to mastication. Next, if tooth structure, loss of tooth structure due to chemical dissolution or chemical process, it is an erosion. And it's occur in a different condition, like GERD, frequent soda intake, frequent vomiting. Third is the abrasion, loss of tooth structure due to mechanical friction with foreign object. This is the abrasion, like due to improper tooth brushing. Next is the abrasion. If loss of tooth structure at cervical area due to abnormal occlusal load, there will be micro cracks, there will be flexure of tooth. This is the abrasion. In March NLE exam, abrasion MCQs was come. Now come to appearance. How we differentiate in appearance? If there is a flat surfaces and we are facet on incisal and occlusal surface, this is the attrition. If there is an ill-defined saucer-shaped lesion, there is an erosion. If there is a V-shaped notch with smooth polished internal angle, there is an abrasion. If V-shaped notch with dull internal angle, this is the abrasion. Now, this is all about non-carious lesion. Now, today our chapter is complete. In next videos, we will discuss another topics. Now, if you like my video, press the like button and share this video with your friends. If you are new to my channel, subscribe my channel by pressing the red subscribe button and also press the bell icon in order to receive my each new video notification. For watching my videos, I am very thankful to you. Thank you very much.